All right. Good evening, everybody. Welcome once again for one more session of financial planning. Today's session is healthcare in retirement. As we all know that one of the most important things for us in retirement is going to be healthcare. Almost about 80% of people in retirement work because they are scared of healthcare costs. Tonight, we have an expert, Douglas Ewing from Nationwide. He's an expert. He is from Retirement Institute of Nationwide Insurance. He is a subject matter expert, and tonight we hope to learn a lot. Douglas, once again, welcome, and the floor is yours.
Thank you. I appreciate it very much, and welcome everybody. It's nice to be here. So tonight our topic is going to be talking about the cost of healthcare and specifically how to plan for healthcare in retirement. So as we begin and we look at our important disclaimer slide here, I do just want to give you a little bit of background about myself and my role with the Nationwide Retirement Institute. I am an attorney by background. I practiced for a number of years before getting back into the financial services industry back in 2003. During that time, I got my certified financial planner designation. However, I do think it's important to point out that despite my background, it is not my intention this evening to provide you with specific advice about how to plan for healthcare in retirement. We're going to talk about things like supplemental healthcare coverage, and I'm going to talk about some of the benefits and the disadvantages of the different types of coverage, but really, you should be speaking with a healthcare, specifically a health insurance professional in order to make those decisions. My goal this evening is to simply provide an overview of how healthcare will work in retirement so that when you get to that point where you have to make decisions, you will have a solid background on the information that we're going to discuss here this evening. So maybe it's because I am a financial planner by background, but when we think about preparing for retirement, in many cases, the way we think about it is in terms of the retirement income challenge. So when you think about that point in your life where you retire and you stop working, really the big issue is going to be, what are your expenses in retirement, and do you have enough income to cover those expenses? So if you joined us last week, we talked a lot about Social Security, which is really a very important element of the income side of the equation. When we talk about healthcare, though, what we're looking at is one of our bigger expenses in retirement. In fact, when we think about our expenses when we retire, on average in the United States, healthcare will be people's second biggest monthly expense in retirement, behind only housing. That is, for most people, housing costs, whether it's a mortgage or rent, that's going to be people's biggest expense. Healthcare comes in at number two. So how do we prepare for that? Well, again, if we think back to last week when we spoke about Social Security, you may recall that there are a lot of decisions that we have to make with respect to Social Security. For example, we can claim Social Security as early as age 62. We can wait as late as age 70 to claim Social Security, and we kind of tackled that last week. Now, with respect to our retirement accounts, there's questions of when we can begin to draw assets and when we have to start drawing assets later on. So on the income side, there are a lot of moving parts. There are a lot of decisions to make. The good news, however, when it comes to Medicare is there's really only one age that we have to remember, and that is age 65. Because at age 65, that is when we enroll in Medicare. Now, before we get into the mechanics of enrolling into Medicare, I do want to address Medicare eligibility, because I know last week we got a lot of questions about eligibility for Social Security benefits. So the standard for eligibility for Medicare is actually the exact same standard as eligibility for Social Security. So as we work, we accumulate what are referred to as credits toward eligibility. And currently, in order to earn a credit, you have to earn just under $1,500. And the most credits you can earn in a year is 4. So realistically, if you make $6,000 of which you are paying into Medicare through Medicare taxes, you would get 4 credits of eligibility for that year. In order to be eligible for Medicare, you have to have a total of 40 credits. So basically, you have to have worked and paid Medicare taxes for 10 years. As long as you had $6,000 of taxable earnings in those 10 years, you will be eligible for Medicare. So that's the first hurdle. And then when we turn 65, that is when we actually enroll in Medicare. Now, if we are receiving Social Security benefits when we turn 65, our enrollment in Medicare is automatic. However, if you recall from last week, you may remember that full retirement age for Social Security is actually going to be either 66 or 67 or somewhere in between, depending on when you were born. So many of us won't be receiving Social Security when we turn 65. If that is the case, then we have to contact the Social Security Administration and actually sign up for Medicare. Now, a very common question that comes up is, well, what if I'm still working when I'm 65 and I have health insurance through work and I like that health insurance and I want to keep that health insurance? Do I still have to sign up for Medicare? Well, the only way I can answer that question is to direct you back to your employer. Contact your human resources person and find out what they want you to do, because generally there are a couple of potential ways that your employer will ask you to handle that. And it depends on the size of your employer and how many people are covered in their health insurance plan. In some cases, for smaller plans, they will probably tell you, go ahead and enroll in Part A of Medicare. And we'll talk in a few minutes about what that is. And in other cases, they may tell you, you don't have to do anything until you actually retire. Now, if that's the case, so if you turn 65 and your employer tells you that you don't need to sign up for Medicare yet, or you only have to sign up for Part A, you can continue to be insured through your work. But it's very important to remember that if you do that, once you retire and you leave employment and accordingly you lose your health insurance coverage through your employer, then you have to act very quickly to sign up for Medicare. Now, technically, you have 8 months to sign up for Medicare, but you're going to want to do it much more quickly than that. And the reason for that is certain types of supplemental coverage you have to sign up for within 2 months. So the bottom line is, if you delay Medicare because you have coverage through work and then you retire, you're going to want to act very quickly to sign up for Medicare. And one thing to be aware of is that if you don't sign up for Medicare when you are supposed to, believe it or not, you could actually incur a penalty. And that penalty is in the form of an increase in your Part B premium. And a lot of people hear that and they say, well, that sounds odd. Why would I pay a penalty for not signing up for Medicare? Well, as we're going to see, when you sign up for Medicare, you actually have to start paying premiums into Medicare itself. And if you don't do that, you don't sign up when you're supposed to, well, you're not paying those premiums. And the penalty is basically designed to recoup those premiums that you should have been paying when you were supposed to sign up for Medicare. So I realize that sounds a little bit confusing, but just remember age 65. If you're not working, go ahead and sign up for Medicare. If you are working, check with your employer and find out what they want you to do. Now, one thing that we do at Nationwide quite often, and I think it's a very helpful thing that we do, is we go out and we talk to people who are approaching retirement, and we will ask them questions about how prepared they are to retire. And recently, we surveyed people approaching retirement, and we wanted to find out what people thought healthcare was going to cost on an annual basis when they retired. And as you can see on the slide, we gave people different ranges that they could get, they could estimate, they could choose a certain range. And then at the bottom, we told people, well, you can also, if you don't know, you can just tell us, I don't know what my healthcare is going to cost when I retire. And as you can see on the slide, over 80% of the people we spoke to either did not know what their healthcare was going to cost, or even worse, were underestimating how much they would have to spend on healthcare in retirement. And so that's really why we put this presentation together. I think by the time we finish, you should all have a pretty good idea of what your expenses are going to look like for healthcare when you retire. At least that's my goal here tonight. So let's start by talking about some of the big concepts that we want to be familiar with when it comes to healthcare in retirement. And the first thing I want to address is how we're all familiar with Medicare. Medicare is a federal health insurance system for people age 65 or older, or certain people who are disabled or suffer from particular illnesses, things like Lou Gehrig's disease or end-stage renal disease, kidney failure, things like that. But generally speaking, this is for people age 65 and older. And there's a big misconception out there, and that is a lot of people think that once they get on Medicare, they won't have any healthcare expenses. It's just going to pay for everything. And unfortunately, that is not the case. And if you remember one thing from this presentation this evening, this should be it. Medicare only covers about 62% of our healthcare expenses in retirement. So we, as retirees, are going to have to cover a pretty significant amount of healthcare costs. Now the question becomes, well, how much are we going to have to pay over the course of our retirement? And that brings us to our next slide. Now the number I'm about to show you, or actually the numbers I'm about to show you, are intimidating. And I don't like sharing these numbers because I think when you see a big number, a lot of times what people do is they kind of just think, well, that number is too big to deal with. I'm not even going to try to plan for that number. But you can, and we're going to talk about how. So here's the number. And so what are we looking at here? Well, the Employee Benefits Research Institute, which is part of the United States Department of Labor, issues a report every year in which they try to estimate the healthcare costs for a healthy 65-year-old couple entering retirement. So the numbers that you see here, 296,000 to 399,000, would represent cumulative healthcare costs over the entirety of our retirement. Now, I don't know about you, but when I see numbers like this, I think, wow, that is a really big number. I don't know if I'm prepared for that, and I don't know if there's anything I can do really to prepare for that. It's too big a number. It's going to throw off all of my finances for retirement. So what am I going to do about that? Well, let me share a couple of observations about this number that will hopefully make you feel a little bit better about it. Now, the first thing I will point out is that I think this number, this estimate, is a little bit on the high side. There are other reports that are issued annually. Fidelity Investments, for example, does an annual report, and they come in at a slightly lower number, $285,000 as an average. So this number might be a little bit high. Now, the other really important thing I need to tell you about this number is you don't have to pay it all at once. So it's not like we retire and somebody shows up at our doorstep and says, hey, congratulations on your retirement. That'll be $399,000, please, for healthcare. Actually, we pay this money gradually over time. And when we think about it, we think about the course of a potentially a 30-year-long retirement, that puts it in perspective a little bit. Because, for those of us who have, bought a home, for example, if you've bought a house, you probably looked at the purchase price of that house and said, how on earth am I going to pay for this? Well, you took out a 30-year mortgage and that's how you pay for it. I've seen similar studies that talk about the cost of raising a child. And raising a child is also very expensive, but we do it over the course of a very long time, and that allows us to pay for it. So keep that in mind when you see this number. And what we're going to do as we go through the presentation today is we're going to demonstrate that really healthcare is more of a monthly or an annual expense. And when we can look at it as a monthly or an annual expense, then we can build it into our retirement budget, our retirement income plan, if you will. So now what people usually want to know when they see a number like this is, well, what goes into that, right? What is it that adds up to these big numbers? So let's take a look at our healthcare costs in retirement. We can break it down into three primary categories. So the first category that we'll address is actually the fastest growing category as far as healthcare cost goes, and that is out-of-pocket costs for prescription drugs. Now, some of you may be thinking, well, wait a minute, I thought Medicare offered prescription drug coverage. It does, and we're going to talk about that. However, even if you have prescription drug coverage under Medicare, many prescription drug plans will have a significant annual deductible, about $400 a year is the average, and they will have a copay where you will be covering about 25% of the cost of your medications. My mom is retired. She lives back in Massachusetts. This is her primary complaint about healthcare costs in retirement, prescription drug costs. So that's going to be a part of it. The second biggest element of costs in retirement is going to be for premiums for Medicare itself. So what a lot of people don't realize is when you sign up for Medicare, you have to start paying premiums, specifically for Part B and Part D of Medicare. We'll talk about what those are in just a few minutes. Now, the good news here when it comes to our premiums for Medicare is that many people have their Part B and D, their Part B premiums deducted right from their Social Security check. Social Security will allow you to have your Part B premium deducted from your check every month. And I think that's helpful, and it makes it a little less scary because if I'm having my Part B premium just deducted from my Social Security check, what does that mean? It means I'm not digging into my own pocket every month and spending part of my retirement savings on these premiums. So I find that makes people feel a little bit better about this element of costs. Now, the biggest chunk of costs that we're going to get for Medicare is for something called Medicare cost sharing provisions. So what are we talking about there? Medicare, like most types of health insurance, has significant deductibles, it has copays, and it has coinsurance. And we're going to talk about in a lot of detail about how those deductibles and copays and coinsurance work when we get into the actual discussion of Medicare. So that's really what we have to pay for. Now, when it comes to these Medicare cost sharing provisions, though, here's some more good news. The way that most people address these costs, the deductibles and the co-pays and the co-insurance, is to go to the private insurance marketplace and purchase supplemental Medicare coverage. And what that supplemental Medicare coverage does is it offsets some of those deductibles and co-pays and co-insurance, and it really boils those costs down into a monthly premium. So when we retire, we're going to have our Medicare premiums. We're also very likely going to be paying premiums for supplemental coverage as well. But what this does is it really takes our healthcare costs and it makes it a monthly expense that we can build into our budget. Okay, so now what we're going to do is we are going to look at the different options that are available for supplemental coverage to go along with your Medicare. Now, I do want to point out here that Nationwide is not in the Medicare supplement marketplace. We do not sell Medicare supplemental insurance. So we're not, we don't really, we don't have a stake here. We don't, we're agnostic as to which route you go here because we're not in this market. This is purely for educational purposes. So we have these two different options here, and these are the two primary ways that you can get supplemental coverage. And we call them option one and option two. I'm going to come up with a different way to describe these two options. I refer to these as the 3-card solution and the 1-card solution. And when I say card, what I'm referring to is a card like you would put in your wallet to show as evidence of coverage. So if we go with option one, the 3-card solution, the 3 different cards that you're going to carry in your wallet are going to be first your red, white, and blue Medicare card, because you are going to sign up for what is commonly referred to as original Medicare, which is Part A and Part B of Medicare. We'll talk about what those are in a minute. Then you're going to go out to the private insurance marketplace and you're going to get secondary or supplemental insurance. Now, I don't know why we don't have it on this slide, but the common name for this type of insurance is Medigap, G-A-P, Medigap coverage. And just like the name implies, what Medigap coverage does is it fills in the gaps in your Medicare coverage. So that's going to be the second card in our wallet. The third card in our wallet is going to be for prescription drug coverage, because Medigap policies are standardized, so they're the same in virtually all 50 states. And by law, Medigap policies cannot offer prescription drug coverage. So you have to go get a standalone Part D prescription drug plan. That's the third card in your wallet. Now, I do want to point out that when we talk about having 3 different cards in your wallet, it sounds very cumbersome, right? I'm dealing with 3 different places. I've got to make 3 phone calls. I have to, it doesn't sound good. But here's the thing. It's actually very seamless in practice, because if this is the way you set up your Medicare, and then you go to the doctors, for example, and the doctor presents you with a bill, what's going to happen is they're going to submit that bill to Medicare. Medicare will pay what they pay. Then it automatically goes to your Medigap carrier. They will generally pay the difference. If you need prescription drug coverage, you will present your prescription drug card at the pharmacy, and it's really not that complicated. So don't be misled by that. So that's the original Medicare Medigap 3-card solution. The other option, option 2, is a very popular program called Medicare Advantage. And I call Medicare Advantage the 1-card solution, because if you sign up for a Medicare Advantage plan, you're only going to be carrying 1 card in your wallet. And that card is going to be issued by the private health insurer / healthcare provider that issues your Medicare Advantage coverage. And one of the primary characteristics of Medicare Advantage is you get all of your healthcare through that one provider. They provide your hospital coverage, they provide your outpatient coverage, and they provide your prescription drug coverage all in one place. It's very convenient, which is why it's a very popular program. About 35% of people who are on Medicare participate in a Medicare Advantage plan. Now, before we move on, I want to address something that's fairly important, and that is the cost. There is a different cost structure for each one of these options. If I go with option one, generally speaking, I am probably going to pay a relatively higher monthly premium for my Medigap coverage. However, if I get sick, my coverage is going to be fairly comprehensive, and I probably won't have a lot of out-of-pocket expense. Now, compare that to Medicare Advantage. If you're looking at Medicare Advantage plans, one thing you will probably notice very quickly is that many Medicare Advantage plans offer a very low, or in some cases, even a $0 monthly premium. And you may hear that and say, wow, that sounds great. How do they do that? Well, they do that a couple of different ways. The first reason they're able to do that is because if you are in a Medicare Advantage plan, you are going to stay in their network. You are typically going to have a primary care doctor, and that doctor is going to be a gatekeeper, and they are going to refer you to different providers within that same network to get your care. So they're going to keep you in network. That's one way that they're able to control costs. Another reason that Medicare Advantage premiums can be very low is that by law, Medicare Advantage plans are allowed to pass through some of the deductibles and copays and coinsurance of Medicare to you. And so when you're shopping for Medicare Advantage plans, one of the things that you always need to ask for is something called the maximum out-of-pocket expense for that plan. Now, by law, Medicare Advantage plans can pass as much as $6,700 per person per year through to the insured person. Most plans, it's going to be less than that, $3,000, $4,000, maybe $5,000 a year. But you always have to ask when you're looking at Medicare Advantage plans, what is the maximum out-of-pocket expense? And so what happens with Medicare Advantage plans is your costs are a little bit less predictable because your annual expenses are going to depend on whether or not you actually get sick or need care, because if you do, you will have more expenses in a year than compared to if you don't. So that's just very general observations about Medigap versus Medicare Advantage. Okay, so we kind of put the cart before the horse here in that we're talking about why supplemental insurance, how it works, but we haven't really addressed yet why we need it. Why is it so important? So in order to understand that, we're going to start looking at Medicare. And when we understand how Medicare works, we will understand why we need supplemental coverage. So the first thing I want to address is Medicare Part A. And when you hear that term Part A, what we're talking about is hospital insurance, hospital coverage, anything inpatient where you are actually admitted to the hospital is going to be covered by Medicare Part A. Now, there's some information that's not on the slide, but I do want to share this with you because I suspect it might be on some of your minds. Now, we talked before about becoming eligible for Medicare and having 40 quarters of coverage, and then we become eligible for Medicare. Now, with Part A, there is typically, if we are eligible, in other words, if we have our full 40 quarters of coverage, there is no monthly premium for Part A. However, if you do not have 40 quarters of coverage, you can still get Part A of Medicare, but you will have to pay a premium for it. So if you have between 30 and 39 quarters, you will pay $252 per person per month for Part A coverage. If you do not have 30 quarters, if you have less than 30 quarters, you can still get Part A of Medicare, but the monthly premium is fairly expensive. You would pay $458 per person per month for that coverage. So if you have 40 quarters, no premium. If you don't, you can still get coverage, but you will have to pay a premium for Part A. Okay, so what does Part A cover? Well, as I mentioned, any type of inpatient hospitalization. Now, if you look at the items on the left, one thing you will also see is skilled nursing facilities and home health care. But I want to be very specific about this. Medicare will only pay for skilled nursing facilities or home health care if they are as a direct result of a hospitalization. And the reason I point that out is that sometimes when we see those terms, skilled nursing facility or home health care, what some people think of is long-term care. And when we use the term long-term care, we're talking about, I'm not necessarily sick. I'm older and I'm infirm because I'm older. Maybe I have Alzheimer's and dementia or dementia, and I'm having trouble taking care of myself primarily due to my age. That is considered long-term care, and it's important to note that Medicare does not pay for long-term care. It will pay for certain things as a direct result of a hospitalization, but if I'm just old and I'm having trouble getting out of bed, using the bathroom, feeding myself, getting dressed, things like that, that's long-term care, and Medicare is not going to pay for that. We'll talk a little bit more about that at the end of the presentation, but I do want to point that out because many people think that Medicare covers long-term care, and it does not. So, as you can see on the right side of the slide, the big issue with Part A is there are significant deductibles and copays. So the first thing we'll deal with is the deductible of $1,408. If you are admitted to the hospital, this deductible will cover your first 60 days in the hospital. By the way, this is not an annual deductible. You could incur this deductible several times during a year. If you have 2 hospitalizations that are separated by 60 days, you will pay that deductible for each one of those hospitalizations. So that's important to note. Now, if I happen to be in the hospital for 61 days, then we see that a $352 per day copay goes into effect, where I now have to pay $352 a day toward my care. If I'm in the hospital for 91 days, now I have a $704 per day copay that I am responsible for. And if I'm in the hospital for 150 days, I can, in essence, run out of my Medicare Part A coverage. And that's why supplemental insurance is so important. Supplemental insurance will cover at least a portion of the deductibles and the copays, and in some cases, it will fully cover all of your deductibles and copays. So that's one reason why supplemental insurance is so important. Now, Part B of Medicare is for, think of outpatient services. So if I go to the doctor's office, if I'm having certain preventative, wellness checkup, things like that, if I need durable medical equipment like oxygen or a walker or something like that, that will be covered by Part B of Medicare. Now, Part B does have a monthly premium, which we'll look at on the next slide. It has a small annual deductible, but the big issue with Part B is coinsurance. And so I'm very happy I'm happy tonight that I'm not on camera, and I'll tell you why. Because on Monday, I had to go to the doctor's office and I had a skin cancer removed from my face. So I have a very large bandage on my face right now. But that's a great example of an outpatient procedure. Now, if I were on Medicare, when I got Medicare would cover part of that, but I would be on the hook for 20% of that cost. So if my doctor sent me a bill for $1,000, I would be on the hook for 200 of that. And that's another reason why we want to have supplemental coverage. Now, we do pay a premium for Part B. And as you can see on this slide, the amount of our premium is tied to how much income we have. But this is a lagging measurement. So for example, if we were to try to determine what our 2020 premium would be, that would be based on our annual income in 2018, because that would be the most recent tax return that Social Security would have access to. And they will look at our income. And as you can see, if our income is, we'll just look at the middle column for a married couple filing a joint return. If our income is less than $174,000 for the year, we will pay $144.60 per person for Medicare Part B coverage. As our income goes up, our premiums go up as well. So that's something to be aware of. And this is why we often tell people, you need to start planning for Medicare before you turn 65. So for example, in the year that you're going to be 63, you might want to consider working with your financial professional, working with Azad to minimize your modified adjusted gross income for the year so that you don't get hit with a big Medicare Part B premium. So there are some things you can do there. That's something, again, you can work with your financial professional on. So now we're going to move to Part D of Medicare, and you may think, well, wait a minute, we skipped Part C. Part C is Medicare Advantage. So we'll come back to that. But Part D of Medicare is prescription drug coverage. And as we've kind of already discussed, there are two ways to get prescription drug coverage. You can get, if you go with the Medigap 3-card solution, you're going to get a standalone prescription drug plan. If you go with Medicare Advantage, your prescription drug coverage is going to be rolled into your Medicare Advantage plan. Anybody on Medicare can get a Part D plan, but here's the interesting thing. There are a lot of different options available for prescription drug coverage under Medicare. And what differentiates these different types of coverage is something called a formulary. A formulary is a list of drugs that are covered, and they vary from plan to plan. It's very important to be aware that you have the opportunity every year during open enrollment, which is October 15th to December 7th, to change your prescription drug coverage. And the reason that you might want to do this is sometimes people find that the plan that they have signed up for doesn't cover, because usually what will happen is people will sign up for a plan, then they'll be diagnosed with a condition that requires a prescription, and then they'll realize, my current plan doesn't really cover this particular medication very well. Well, if that happens, you can switch to a different prescription drug plan. In fact, if you go to Medicare.gov, which is the Medicare website, and you start researching prescription drug plans, they will actually ask you what types of medication that you're on so they can match you with a plan that will offer coverage for what you need. So that's something to be aware of. You can try to pick a plan that covers the specific medications that you need, and that can work pretty well. Now, when we think about Medigap insurance, and again, this is the 3-card solution, just a few things to be aware of. And these are some things that this is something that people really like about Medigap coverage. Medigap, as I mentioned before, is standardized. A policy in California is going to be identical to the same Medigap policy in Florida. And because of that, you have some flexibility. And you can see any doctor in America who accepts Medicare. And so for people who travel a lot, people who spend time in different parts of the country during the year, this can be very beneficial because you know that, hey, if I get sick, All I have to do is find a doctor who takes Medicare, and I know they're going to take my coverage. Remember, Medicare Advantage, you've got to stay in a network. That's a little bit different. The other thing about Medigap that people like is it's very comprehensive. My mom, back in Massachusetts, has a Medigap policy. And whenever she has an issue, I ask her, did you have to pay for anything? And usually she says, no, they pay for everything. It's great. Because the coverage is comprehensive, what sometimes they will do, or what that means is Medigap insurance carriers sometimes are selective about who they want to cover. So there's a special rule. If I sign up for Medigap within 6 months of signing up for Medicare, I am guaranteed to get Medigap coverage at the prevailing rate in my area. If I wait until after 6 months from when I signed up for Medicare, then when I apply for Medigap coverage, they can ask me questions about my medical history, including any pre-existing conditions that I might have, and they can charge me a higher premium, or they could even deny me coverage. Now, the various states will tweak these rules a little. So for example, in California, if you sign up for a Medicare Advantage plan and on your 1-year anniversary of that plan, you decide you want to switch to a Medigap plan, you will be able to do that. But that's not the case in every state. That just happens to be a California rule. So be aware of that. If you have a pre-existing medical condition, like for example, diabetes, and you think you want to be on a Medigap plan, you might want to sign up for Medigap right when you're signing up for Medicare, just to make sure that you get in and they're not going to ask you any questions about your medical history. That is something to consider. Now, what everybody wants to know is, what is all of this going to cost? So when we look at the chart that you see in front of you, keep in mind, we are looking at the Medigap 3-card solution in this example. And sometimes people ask, well, what about Medicare Advantage? Medicare Advantage is going to work a little bit differently. I'll talk about that at the end. But so here's what your monthly costs might look like. So for Medicare Part A, again, if I have 40 quarters of coverage, I will not pay a premium. If I have less than that, I may have to pay a premium for my Part A. But for most people, it'll be 0. Medicare Part B, assuming my income is under $174,000 for a married couple, I will pay $144 per person per month. Then I'm going to go get my Part D prescription drug coverage. The good news there is not a very high premium, generally $50 to $60 per month. And then I'm going to go out and I'm going to get my private Medigap plan. Plan G is a very comprehensive plan. There are others, but we'll use that for our example. Now, here's where I have to caution you. This slide was put together by my colleagues who live and work in Columbus, Ohio, which is where Nationwide is based. And this Medigap Plan G premium is for Columbus, Ohio. In California, you will pay a higher premium. I've seen premiums range anywhere from $200 a month to $250 a month for this same coverage. The unfortunate reality is, when it comes to healthcare, your zip code matters. So where you live is going to have a big impact on what your costs are going to be. So we can add that up and we come up with a total per person. But if you are married, remember, all of the coverages that we've been discussing under Medicare are individual coverages. There is no family coverage under Medicare. Everybody pays as an individual. So that means if we're dealing with a married couple, we would have to double those monthly expenses. And then when we look at them on an annual basis, again, in California, you could easily be looking at $8,000 or $9,000 a month for basic Medigap coverage for California. Now, that's a lot of money. You know, $9,000 a year, I should say, is a lot of money. But the good news is, you know, when we think about it as an annual expense, it's a little bit less intimidating than that awful $399,000 number that we saw earlier in the presentation. So again, sometimes people will ask me, well, would this work the same way for Medicare Advantage? And unfortunately, the answer is no, because and Medigap tends to be a little bit more budget friendly. So if we were doing Medicare Advantage, our Part A premium would stay the same. Our Medicare Part B premium would stay the same. Now remember, our Part D premium would be wrapped into our Medicare Advantage premium, and that might be lower than what we see here. But remember, with Medicare Advantage, your costs from year to year can change depending on whether you need care because of that potential for out-of-pocket expense. So that's how it's going to work a little bit differently for Medicare Advantage. Now, while we're on the subject of Medicare Advantage, again, as I've mentioned, this is a very popular program. The key attributes are, again, you're going to have to stay in a network. Your Part D coverage is going to be included. Now, there's another feature of Medicare Advantage plans that people really like, and that is Medicare does not pay for hearing, dental, or vision. Medigap does not pay for hearing, dental, or vision. Medicare Advantage plans, however, can include coverage for hearing, dental, and vision. And sometimes what you'll see is when we get to the end of this year, you'll probably notice on television that there will be lots of television commercials for Medicare coverage, because that's the open enrollment period. If you hear somebody talking about, hey, this plan includes hearing and dental and vision, that's your cue. You know, that's a Medicare Advantage plan, because only Medicare Advantage plans can do that. Now, the good news is we said sometimes Medigap plans can be difficult to get because of those screening questions outside of the 6-month window. Generally, that is not an issue for Medicare Advantage. Usually, it is very easy to get a Medicare Advantage plan, and it's very easy to switch to a Medicare Advantage plan. In fact, the only medical condition that will cause a problem getting on a Medicare Advantage plan is if you have end-stage renal disease or kidney failure. That can be a problem. But other than that, it's always very easy to get a Medicare Advantage plan. So when do we apply for Medicare? Well, we already talked about turning 65. That's the magic age. You technically have a 7-month window in which you can get on Medicare. But most people will say, hey, I'll get on Medicare as soon as I can. And what I found is even among people who are working and have employer coverage available through work, I would always check and compare the cost of getting on Medicare and getting a Medicare supplement to what you are paying for health insurance through work. There are scenarios where it's actually more economical to get on Medicare rather than to keep your health insurance through work. So that's something to consider as well. We have a lot of resources available. Medicare.gov, again, that's the website you can go. I do want to point out here, though, that while we're providing you with a very general background about healthcare in retirement, there's really no substitute for talking to a health insurance professional who can help you navigate these different types of coverages. Because really, when you sit down with a health insurance professional, they will be able to match you up with the best option for your particular circumstances. So I really encourage you, if you're getting close to Medicare age, talk to Azad, see if there's someone available that you can talk to about health insurance, because that will be a big help. So how can Nationwide help with this? Well, if you remember last week, we talked about our Social Security Analyzer. We have a very similar tool in the health care space. As we discussed, we know that a majority of pre-retirees do not have an accurate estimate of what their healthcare costs are going to be. So we came up with something called the Healthcare Cost Assessment Tool. And what we did when we were developing this tool is we went to a company called Milliman, one of the largest actuarial firms in the world. And we said, we want to build a calculator that will help provide people with a personalized estimate of their likely healthcare costs. And so Milliman said, okay, well, here's what we're going to need. We're going to need a basic health profile. We can use statistical information about longevity. In other words, how long we're going to live. We're going to need to know where the person is going to live, because again, your average annual healthcare expenses are going to be largely dependent on where you live. And it's not as simple as, well, if you live in an urban area, it's going to be expensive. If you live in a rural area, it's going to be inexpensive. Sometimes it's surprising, and sometimes we find that urban areas can be less expensive than rural areas because there's more healthcare available. So we take all of that into account based on where you're going to live, and we can prepare a report for you that will break down those expenses. Now, in order to get the report, we do have to ask some basic information. This is a fact finder that we use to get that. You can get a copy of this through Azad. And the information we need is very basic information. It is not, these are not invasive, embarrassing questions. We basically need to know things like, do you have high blood pressure, cholesterol, diabetes, cardiovascular disease, any history of cancer, multiple sclerosis? Are you a tobacco user? And the information that you provide to us goes no further than the report. We do not use it for any other reason. We'll ask you what you think your income is going to be like so we can estimate Part B premiums. We'll ask you if you want us to include supplemental coverage in the report. We can certainly do that. And then we can provide an estimate. Now, there's one other thing that we cover in this report that I did not, that I do want to go back and talk about just very briefly. We can also run a long-term care cost assessment. So some people might be concerned, if I get older and I need long-term care, how do I prepare for that? Well, one way that you can prepare for that is through long-term care insurance. And as you're figuring out whether long-term care insurance is something that you want to consider, it might be helpful to see what long-term care actually costs. Now, I will caution you that if you get a long-term care cost assessment in the report, again, we're going to be looking at some big, scary numbers. And the reason for that is if you end up needing long-term care, you're not going to need it next year or even a few years from now. You're going to need it 20 years from now or 25 or maybe even 30 years from now. And so we have to consider inflation in that estimate. And so you'll see some really big numbers, but the good news is the earlier you plan for the cost of long-term care, the less money you will have to invest in that care. If you buy a long-term care policy now, it is going to be a lot less expensive than if you end up having to pay for long-term care insurance yourself in the future. And we have a lot of options with respect to long-term care. The way that insurance companies offer long-term care has changed dramatically in the last 10 to 15 years. It used to be like my mom has a long-term care policy. She pays an annual premium. If she has a long-term care event, she'll be covered. But if she doesn't, all of those premiums that she paid, they're kind of a sunken cost. Nowadays, you can buy life insurance with a long-term care rider, or you can buy a hybrid long-term care policy where if you need long-term care, you're covered, but if you never need it, we'll pay a death benefit to your beneficiaries instead. So that whole idea of use it or lose it that people hated about long-term care insurance 20 years ago, that's really kind of been retired, so to speak. So with that, I'm gonna say I'll just wrap up by saying, hopefully you feel a little bit better about healthcare costs now. It's part of our retirement income plan. What we can do is help you look at healthcare costs as an annual expense that you can plan for. And when you have those numbers available, you can sit down with Azad, you can figure out, hey, this is what we need to budget, and you can factor it into your retirement income plan. And that should hopefully make it a lot less intimidating. So with that, I want to turn it back over to Azad, and if anybody has any questions, I would be happy to try to answer them.
Awesome, Doug. As usual, a very informative session. Thanks a lot. There are a lot of information there, and of course, some scary numbers. Hopefully, that will not scare people, but motivate them to plan better for a peaceful, great retirement. Let me see if
Yes.
we have any questions here. I think you should be seeing in the chat, right? So
yeah, I don't see any questions in the Q&A box. It's a
Okay.
lot of it's a lot to cover. So
correct.
But what
Nimish,
yes.
sorry, Doug, I'm having a very spotty connection over here. So I have asked Nimish to raise some questions. So Nimish, can you read out the questions?
Yeah. Can you guys hear me?
yes.
Okay.
Yes.
Okay, Doug. So the first question on YouTube we have is, do I need to be on Social Security to get Medicare coverage?
You don't have to be on Social Security. So in other words, if you turn 65, you can sign up for Medicare even if you're not receiving Social Security yet. Now, the separate question is, are you eligible for Medicare? If you are eligible for Social Security, and again, this goes to that whole issue of having 40 credits, 40 quarters of credit. If you're eligible for Social Security, you will be eligible for Medicare. If you are not eligible for Social Security because you have not worked for a long enough period of time, remember you need roughly 10 years, you can still get Medicare, but you may have to pay a premium for your Part A coverage. So hopefully that answers the question.
Okay. Thanks, Doug. So I have 3 more questions on YouTube.
Sure.
So the second one is, can immigrants to the United States get healthcare coverage if they are over 65?
Well, yeah. So the issue here isn't necessarily your immigration status. It's really a question of, did you pay into the system? So if you paid into the system for 10 years and you are now eligible, then again, I don't know of any. I've been covering Social Security for 12 years. I have never seen immigration status come up as an issue. It's really more eligibility in terms of, did you pay in for the requisite 10-year period? If you did, you're going to be eligible for coverage. And I'm pretty confident that you're going to be eligible for coverage regardless of your immigration status. Now, one issue that you might want to be thinking about is, well, what if I'm not going to be in the United States, on a regular basis when I'm retired? So if you might be, if you might be in a different country while you're retired, then things get a little bit complicated, because you may not necessarily want to be paying for Medicare coverage, because Medicare does not provide coverage outside of the United States. So that is something to be aware of. And so sometimes what we'll see is, even with United States citizens, they might decide to live abroad after they retire. And then it's a question that you would want to sit down with a healthcare professional and figure out, okay, do I even want to be paying for Medicare right now because I'm living out of the country and I'm not going to have coverage out of the country? So as far as eligibility goes, it's really more a question of whether you've been paying into the system. In other words, if you've been paying your Medicare taxes because remember, when you work in the United States, regardless of your immigration status, you're going to be paying into Medicare. You're going to be paying Medicare payroll taxes as a part of your employment. And if you pay those Medicare payroll taxes for that 10-year period, you're going to be covered. And I'm fairly confident that coverage is going to be irrespective of your actual immigration status. So I hope that helps.
Okay. Yeah. Thanks for the clarification. The next one is, if the husband is on a coverage from wife's employer and the wife is retiring, what are the options? What options are there until the husband becomes eligible for Medicare?
Yeah, that's a very common question. So just to kind of paraphrase, so this is a scenario where we have one spouse is working and they're getting health insurance for both spouses through work. And now the working spouse is getting ready to retire, and the working spouse is eligible for Medicare, but the non-working spouse, who is in many cases younger, they are not eligible for Medicare yet because, let's say, they're only 62 or 63. That is a bit of a dilemma in many cases. There are some employers that might offer a coverage option where, you know, especially in the public sector, I've seen plans where one spouse can get on supplemental coverage for Medicare, and they will also be allowed to cover the spouse who's not eligible for Medicare. But if I'm in the private sector and I'm retiring and now I'm going to get on Medicare, but my spouse is going to lose that coverage through work, that can be a bit of a dilemma. And what you're probably going to have to do is go out to the private insurance marketplace for individual coverage. Now, this marketplace is a little bit more robust now because of the Affordable Care Act and the fact that there are individual coverage exchanges. For example, in California, you have Covered California. So you could go to Covered California and you could find options for that younger spouse. It's going to be more expensive, unfortunately. It's going to be, you know, in many cases, it could be almost double what you would pay when you actually get on Medicare, and you can just get supplemental coverage through Medicare. But in California, I think Covered California, and I think it's coveredcalifornia.gov. I don't know exactly what their website is, but that would be the place you would want to go to look at the coverage options for the younger spouse who's not Medicare eligible yet.
Okay. So, and the last question which I have is, will there be any help for someone who cannot afford Medicare premiums?
Well, you know, that's a good question. And I'll be very honest, I have not looked at that question before. However, what I will tell you is we've been talking about Medicare, which is health insurance for seniors, people age 65 or older. In California, you also have Medi-Cal, which is a Medicaid program administered by the state of California. And Medicaid programs cover people with limited income or resources. So, because the general answer to your question is, I am unaware of there being any sort of premium relief for the different premiums, you know, for your Medicare Part B premium or supplemental Medicare coverage. So if you are in a situation where you have limited income and limited resources and you really cannot afford those Medicare premiums, then what you might want to look at is whether you are eligible for coverage under Medi-Cal. Because remember, Medicaid is our program for insuring people who have limited assets and limited income. And so you might be able to qualify for Medi-Cal, which is the California Medicaid program, if your situation is, if your income and your assets are sufficiently limited. And there are a lot of guidelines as to whether you qualify for Medi-Cal or not. It's a little outside of my area of expertise, but that would be my advice, would be to first contact Medicare and say, hey, look, I can't pay my Medicare premiums. What do I do? It will probably refer you to, in California, it would be Medi-Cal, to see if you qualify for coverage there.
Okay, all right. Thank you for your informative answers. That's all I have, at least from the YouTube.
Excellent.
Okay, well, thank you. Thank you.
So I think we have a couple of them here. Obama healthcare insurance, Medi-Cal and healthcare is going to cover over Medicare plan. Did you understand that question?
I'm sorry, can you repeat it?
Obama healthcare insurance, medical and healthcare is going to cover over Medicare plan. So basically, I think the question, yeah, go ahead.
No, yeah. What do you? I'm not sure if I am understanding what they're asking. Is like, when do I do Medicare versus Medicaid, or?
No, it's not Medicaid. It is basically medical and healthcare. Obama healthcare insurance, medical and healthcare.
Oh, Obamacare.
Yeah.
Okay. So yeah, that's what we were referring to earlier with the healthcare exchanges. So, for example, Obamacare, or the Affordable Care Act, is administered in California through a program called Covered California. And so really the issue is, how old are you? If you are not 65 yet and you need healthcare coverage, that's where you're going to go. You're going to go to Covered California and check with them. And that is what is known as a healthcare exchange. So there should be multiple different policies available through Covered California. You can pick what's going to be best for you. Once you're 65, then you're going to go the Medicare route with the Medicare supplement, because that's going to be significantly less expensive. So Covered California, you can get individual coverage, on the exchanges. Now, whether you qualify, so if you are low income and you go to Covered California, under the Affordable Care Act, if your income falls within certain ranges, you can get assistance to pay for your healthcare coverage through the exchanges. And I'm not an expert on how they administer that, but I do know that there is assistance available based on your income through that program. So hopefully that helps.
That's right, Doug. Basically, the Obamacare individual states, they are implementing in a different ways. So some of the red states were not so encouraging, but some of the blue states, especially California, has become one of the big things. They have done a very good job of providing the access to the health care for a lot of people who do not have. So that way we are lucky to be in California. That so bottom line is, if we do not have the coverage, medical coverage through the employment, we have some options in California and in some of the states through these exchanges.
That's correct.
Today's topic about mostly about retirement healthcare. That is where we need to do some advanced planning, especially when it comes to the long-term care and others. It's not as if Medicare covers everything. That's one of the takeaways from your total session today. There are costs, especially the Medigap insurance is a huge cost, and we do need to be prepared to have that kind of expense in addition, in order to fill that gap in the insurance part of it. A lot of people, Doug, in my interaction, feel they are under impression that they are automatically covered for 100% in retirement with Medicare, which is not true. We need to educate. And long-term care, a lot of people think that it is regular hospitalization, and the slide you have that's a very, very useful slide, where in hospitalization, how many days it covers and what is the expense
Right.
copay, and especially after 100 days, how difficult it is. That is, you're basically on
That's
your own.
right. That's
So,
exactly right.
yeah, that is where these sessions are important for us to understand the need for advanced planning. We have, I think, one more session. Uh, okay, there is a question here. Slide 22. Is wife covered before 65? I think for Medicare Gap card. I don't know what that slide 22.
So, yeah, I can go back and look at slide 22. Let's see. But I will tell you, I'll go ahead and start answer. Yes. So when we look at slide 22, this is the breakdown. So this, what we're assuming here when we double up is that we have two spouses and they are both age 65. If we have one spouse who is 65, but then we have the other spouse who is not yet 65, then they will basically have two different policies. Because remember, once you're on Medicare, there is no such thing as a family coverage where it's covering you and your spouse. You're going to get, the 65-year-old is going to get their coverage. They're going to get their supplemental coverage. If you have a spouse who's 62, unfortunately, they're going to have to go to the individual marketplace and get a policy because they're not Medicare eligible yet. So they would have to get this regular health insurance until they turn 65 when they're eligible to get on Medicare. And that's a big expense for people. And that can be a big dilemma in terms of, if I'm looking to retire, I might be 65 years old and I say, hey, I'm ready to retire. But if my spouse is 63 and if I retire, they're going to lose their health insurance through my employer. Sometimes people will say, well, I guess I'll work until I'm 67. Then my spouse is 65. Now I can retire. We can both get on Medicare, and that will be a lot more cost effective.
Yeah, that's quite a dilemma. That is.
Yeah, that's a big issue, and we see it a lot. When people, because a lot of people do want to retire before they turn 65. And I've talked to many people over the years, and that the one thing that will typically cause them to maybe reconsider their decision is the cost of healthcare. People say, oh, I want to retire when I'm 60. That sounds great. But then when you realize that a healthy 60-year-old couple could easily spend $1,500 a month in health insurance premiums, while they're waiting to turn 60, it's a big expense. So, and I wish I had an easy solution for that, but I don't. So, but for the spouse who's a little bit younger, sometimes it might mean working a couple of extra years or, just having to budget some extra money to pay for the health insurance for the younger spouse until they turn 65.
Excellent. The next question we have is, California has Medi-Cal. Is that different than having Medicare? I can take this. Yeah, I think you already explained also. Medi-Cal is essentially a California-specific program which actually gets funds from Medicaid, from the federal government. Medicaid is for people who are basically in a poverty designated people who cannot afford for their entire assets have to be under 15,000 cap, and they basically are not able to afford. So each state gets their funds.
That's exactly right.
California has its own budget, adds those funds to the Medicaid program, and they have much more liberal program called Medi-Cal. Most people who are able to work and acquire some properties will not be able to eligible for that. So that is where all this planning about Medicare and all. Medi-Cal is essentially, bottom
Right.
line, is for poor people, people who cannot afford absolutely even that coverage.
Yeah.
Do you want to add
And
anything? Or?
Yeah, just very quickly. So one thing that comes up sometimes, it has to do with long-term care. And some people will say, well, wait a minute, I thought that Medicaid, or in this case, Medi-Cal, will pay for long-term care. And the only time that Medi-Cal would pay for long-term care is if you basically if you go through all of your assets. And so you get to the point where you have nothing left. At that point, Medi-Cal will pay for long-term care, but it is not an optimal solution, because you are going to be very limited in your long-term care options if you do that. So that does sometimes come up, and people say, well, wait a minute, I thought Medicaid would pay for a nursing home, for example. Well, they will, but only after you've spent down all your other assets, and then assuming that you qualify, you're going to have very limited options. You're not going to end up in the nicest nursing home. You're going to be in a what's commonly referred to as a Medicaid bed, and you're going to be sharing a room with somebody. It's not going to be an optimal scenario. So I do like to point that out. So for people who have some resources, it's always better to plan for long-term care than to, think, well, I'll just get on, Medicaid or Medi-Cal and they'll pay for it. That, yeah, they may do that eventually, but it's not going to be a very pleasant experience for the family or for the person who needs that care.
And there is one more, is the states do retain the right of recovery from the estate, and also they have a look back period of about 5 years, and they're pretty good about that. Okay.
Yeah, that's going to vary from state to state. I'm not an expert on how California does that, but typically, yes, if Medicaid ends up paying for long-term care expenses, they will, for example, put a lien on property owned by the person, and they will try to recover some of that expense. So if you find yourself in a situation like that, my advice would be if you can find an elder law attorney who is experienced in Medicaid planning, that can be something that is worth looking into, because because it's complicated, and it's not something that you want to try to figure out on your own.
Okay. How can I get estimate for supplemental insurance? Is premium fixed? Does premium increase with age?
Those are very good questions. So that second question, is the premium fixed or is it going to increase with age? There are different types of pricing available for Medicare supplemental insurance. And some policies, and typically they'll be based on a geographical area. In some areas, they'll do community pricing where everybody basically pays the same. There are other types of pricing where your premiums can go up as you get older. It really varies from area to area. A good resource to get basic information about the policies that are available and how much they cost and how they're priced in terms of whether they do community pricing or different types of pricing models, Medicare.gov. So if you go to Medicare.gov, and you can go to two places. It used to be a lot easier, but now you have to go to two separate places. There's one page you can go to for Medigap. There's another page you can go to for Medicare Advantage. But once you get in there, you can type in your zip code and they will show you the plans that are available in your zip code. And that's, yeah, there we go. So you can go in there, you can enter your zip code and it will show you, for example, what premiums are going to look like for the different types of coverage that you look for. If you click up on supplements and other insurance, that might be that might get you there pretty quickly. Find a Medigap policy. So right in the middle, right above that. Yeah. So if you click on that and then you enter your zip code, it will pull up different plans that are available. And you can see a couple of different things on this page. So it will give you your monthly cost. And so it would tell you, for excuse me. So you might be looking at, say, well, what's the difference between Plan A and Plan B? There is information in there where you can get the difference, find the difference between the different types of plans. But then, for example, if you want to scroll down, Azad, we could look at Plan G, for example, because Plan G is fairly comprehensive. It's a very popular option. So yeah, I think we just went by, not the high deductible, but well, yeah, so you can, now you click on view policies. So it shows you what the benefits are covered. So, skilled nursing covers your Part A deductible. And there you go. So now you see, and this actually is perfect because this answers the question that was asked. So what we see here is if we look at the United Healthcare option, the AARP option, you'll see on the right side, it says community pricing. So what that means is the premiums are the same no matter how old you are, but they may go up due to inflation and other factors. So that's pretty common. So that gives you an idea of, hey, are my premiums going to change over time? In this case, yes, they could go up a little bit, but the point is they're going to go up for everybody. So they're not just going to go up for you. And
okay.
And then each link will take you to the company website and all of that information as well. So hopefully that gives you a little bit of an overview what you can find on Medicare.gov.
Okay, that's a great place to get lots of information, Medicare.gov. I think we are running short on time. Couple of quick questions. Does wife has to have 40 credits to be eligible for Medicare?
Oh, excellent question.
Already eligible for 40 credits.
Yeah, I'm really glad that whoever asked that because I neglected to mention that. No, if one spouse qualifies, has their 40 credits, both spouses will be eligible for Medicare. So if you had a non-working spouse at home, when the working spouse qualifies for Medicare, then the non-working spouse qualifies for Medicare as well. So both spouses would be covered, meaning that they would get their Part A with no monthly premium.
Excellent.
So Azad, I have one more question on YouTube. If Zoom questions are done.
Okay, go ahead and ask.
Okay. So does Medicare cover in-house care and hospital care? And if so, to what extent?
So yeah, so they will cover, Medicare will provide a limited amount of coverage for skilled nursing and home health care if it is as a direct result of a hospitalization that lasts for 3 days. So if I'm in the hospital for 3 days and, for example, they send me to a rehabilitation hospital, or maybe they send me home, but they send a visiting nurse to come out and, if I had my hip replaced, they might have to change the bandage and all that stuff. They will provide limited amount of coverage, 100 days, but only as a direct result of that hospitalization. So, so again, if it's just a case of I'm getting old and I'm having trouble getting around and I have to go to a nursing home or I need somebody to help me get dressed in the morning, Medicare is not going to cover that. But if you need some skilled nursing as a direct result of a hospitalization, they will cover that for a limited period of time.
Okay, awesome. Thank
I have
you
one
for
question, Doug. You said as soon as people approach 65, it's advisable to enroll. For whatever reason, if somebody, you also mentioned about the penalty part of it. For whatever reason,
Yes.
if somebody has not enrolled, say for a year or two, when they enroll, do they have to pay for the entire couple of years?
So yeah, so what they will do is, let's say I turn 65, I don't have health insurance through work, I'm supposed to sign up for Medicare. But let's say just because I just didn't realize, nobody ever told me. So now I'm 67, 2 years have gone by, and I just realized I need to sign up for Medicare. So how does the penalty work? The penalty is going to attach to my Part B premium. So now normally, you know, assuming my income was low, I would pay $144 per month, right? But the penalty is 10% per year. So after 1 year, I would pay an extra, call it $15 a month. So that would get me up to $160 a month. If I'm another year late, that's another $15 a month. So I would actually pay $175 a month instead of $144 a month. So you don't have to go back and pay for the full 2 years, but that 10% per year penalty is going to stick on your Part B premium forever. So now instead of paying so if I missed it by 2 years, instead of paying $144 a month, I'm going to pay $174 a month. And that's going to be my premium going forward.
So I kind of, so there is that cost which is calculated total and added to you going forward. So there, in a sense, you have essentially paid for the year missed, even though you've not used any of the that benefits. Is that a right way to frame?
I mean, that's the rationale behind it is, well, you know, you were supposed to be paying $144 a month, but you didn't. So we're going to assess this this 10% per year penalty on your Part B premiums. And that is going to basically follow you throughout the rest of your retirement. So yeah, so that's why you do want to make sure, hey, when it's time for me to sign up, I got to sign up. So.
Okay, excellent. So, I think, do you have anything else there?
No, I don't see anything.
Okay, 1 second.
I think, yeah, this has been a very informative session, Doug. Thank you very much. A lot of eye-opening.
Well, you are very welcome. No, it was my pleasure to help out, and you guys were a pleasure to work with. And yeah, maybe we'll do it again sometime in the not too distant future.
Thanks a lot.
Yeah.
Thanks a lot, Doug.
And sorry to hear about your thing. Take care of yourself.
Oh, well, you know, I noticed when we started the call that you guys weren't on camera, and I didn't say anything because it's like, nah, it's fine. It's nothing serious. But I just have a big bandage on the side of my face. So I was happy to stay off camera today.
Okay. Thanks a lot once again. We do appreciate you taking time and patiently answering all the questions. Very, very useful information. And hopefully we would like to have you in future on same topics or different topics. Thanks a lot for all the audience of people who are attending. I hope you are enjoying these sessions and getting a lot of information. And we have a few more sessions lined up. And these are the sessions that are lined up for the next three more, I think, three more Thursdays. Again, Thursday at 8 o'clock. The next session is going to be on a long-term care. I'll be taking care of that. And then we have passive investment by Leela Prasad, and then investment management. I'm trying to get an expert, but otherwise we'll be trying to cover that as well. Please do drop a line, give your feedback if you're liking these sessions, and if you have anything specific that you want to be covered, please send an email or send a text message or WhatsApp, whatever, including YouTube. Along with Samasti, we are very happy to bring these sessions to every one of you there out there. So this is my information, contact information. If any one of you are interested, there I do give 2 hours of complimentary session for people who have attended this. I call it a financial physicals. It is very important in order to achieve our goals and to do a proper planning. We need to know what is our current state. So you can take this information and give me a call or go to my Calendly account and schedule your session. Leela Prasad, do you have anything to add?
No, I think you covered upon this is really helpful, and yeah, feedback is important. Everyone, if you can provide us some feedback on how sessions have been going on, and if there are any specific sessions that you would like to learn or are interested in learning, please pass it on and we'll try to arrange.
Excellent. Thanks a lot once again, everybody. Have a great night.
Okay, thank you.